Good evening, Mr. Chairman and members of the committee. My name is Vasu Ready, and I am a policy counsel at the National Partnership for Women and Families. We are a nonprofit, nonpartisan advocacy group that has worked for more than 4 decades to promote fairness in the workplace and policies that help women and men meet the dual demands of their jobs and families. I appreciate the opportunity to speak today in support of House Bill 5413, legislation to provide Rhode Island's workers with access to paid sick days. Simply put, the evidence is clear that when workers have paid sick days, people, businesses, and communities do better. First, paid sick days have proven benefits for the health of workers and the public. This is especially important because workers who have the most direct contact with the public, such as restaurant workers and childcare workers, are among the least likely to have access to paid sick days through their jobs. When workers have paid sick days, they're less likely to come to work with a contagious illness and spread an infection to their customers or their coworkers. Parents can stay home to care for a sick child instead of having to send the child off to school with a dose of Tylenol and a hope that the illness doesn't get worse or spread to other kids. One study found that after 7 U.S. cities implemented paid sick days laws, the general flu rate in those cities went down, helping prevent an estimated 100 flu infections per week for every 100,000 people. We also know that workers with paid sick time are more likely to access preventive care and seek timely treatment for illnesses, which allows them to catch problems before they become more serious and require emergency care. Second, evidence from the cities and states that have implemented paid sick day standards shows that the benefits of these policies for businesses are real and the downsides are virtually non-existent. Now, my written testimony has more detailed points on these issues, and so I won't regurgitate every single point now, but I'll give you the highlights. Basically, employers have seen their productivity go up because workers don't have to muddle through work when they're sick and less productive. Morale has gone up, turnover has gone down, and the quality of new hires has improved. Businesses in the locations with paid sick days laws have not faced significant difficulty or costs in complying with the laws, and overall, most employers there support the paid sick days laws. And finally, paid sick days laws have not caused the economic harm that their opponents predicted. Again, my written testimony goes into more detail, and I believe someone else will be speaking later with some more specific analysis. But basically, we know that in several of the cities with paid sick days laws, the number of businesses grew after the laws took effect, and there is no evidence that businesses had closed or chosen not to open because of the laws. San Francisco, Connecticut, Seattle, and New York City all saw job growth, including in the industries most affected by the laws. And in San Francisco and Seattle, that growth was specifically compared to the surrounding areas and was found to be higher than the surrounding job growth during that time period. Consumer prices fell, and wages and labor force participation went up. Even the vice president of the San Francisco Chamber of Commerce, which led the fight against that law with dire predictions about the economic harm that it would wreak, said that for the most part, the impact of the law on the economy had been minimal, and that actually San Francisco's economy was booming. This is only a small sample of the growing body of evidence for the clear benefits of paid sick days laws, and lawmakers around the country are recognizing these benefits. In 2016, 3 more states, 1 county, and 9 cities enacted paid sick days laws. We applaud Rhode Island for being among the forward-thinking group of cities and states leading the way on paid sick days, and we urge you to advance this bill. Thank you, and I look forward to answering any questions you might have.